Hello, I am Dr. Rakesh Chincholikar. I have done MBBS, DCH and fellowship in neonatology from Wadi Hospital, Mumbai. I am here with ONP group of hospitals since 2 years. We will understand what is neonate. Neonate is the baby after delivery till 4 weeks. Considered the 28 days is considered as a neonate. We label these babies as a neonates. Neonates in India, the term is labeled as a neonatal mortality rate. That is the death of the neonates, that is within 4 weeks from the birth is considered as a neonatal mortality rate. That is the proportion with the per 1000 live births in India. Previously, the neonatal mortality rate was very high. That is because of the problem associated with the deliveries like prematurity, the infection, pneumonia problems and diarrheal problems, which are very common things in neonates. So these problems are high in Indian babies. So the neonatal mortality rate was initially it was around per 1000 live births. Now it is coming down with the latest technology in the neonatology. In the neonates, the applications are nothing but the neonate associated with like a premature delivery, the infection that is labeled as a sepsis, the pneumonia which are very common, the neonatal jaundice, and there are multiple medical emergencies also in neonatology like neonatal pediatric surgical problems. In the latest neonatology updates and the success in our ONP group of hospitals, we have handled which are IVF deliveries of twin delivery of a 720 gram and 760 gram, and that was around 26 weeker delivery which is labeled premature delivery, and we have successfully discharged at the weight of 1.3 kg with a good health and with the successfully breastfeeding with the mother. To remain in continuing this medical training, we usually used to attain the CME, that is called as continuing medical education, in the form of Mahaneocon, Mahapedicon. So we usually every weekly we will have a meeting with the neonatology cases discussion along with pediatric cases discussion also, and what are the latest updates in that. With the help of this continuous medical education, we used to apply and we used to discuss all the cases within ourselves so that everyone will get update about the neonatology. In latest technology, as our discussion just now I told you regarding the neonatal mortality rate. So we are coming out with this neonatal mortality rate because of the update in the neonatology. That is in the form of high frequency ventilation, invasive ventilation, non-invasive ventilation, along with that early treatment that is called as early intervention in the form of early stimulation with the baby, physiotherapy also is the part of neonatology. Along with that we have a high flow ventilation that is called as HFOV. Along with that we have ionotechnology for the PPHN babies. That means PPHN is nothing but the baby who has not cried at birth, they will develop some birth asphyxia, that meconium aspiration. Sometimes the baby will ingest the meconium in intrauterine period. This baby will develop some respiratory distress in the form of PPHN, and we need to give some INO, that is called as INO. Along with that, the birth asphyxia, as just now I told you, birth asphyxia means the baby who had not cried at birth. So for this baby, we usually apply the therapeutic hypothermia modalities, which is right now under investigation in India also, but still we are really, the effects of that is really wonderful, and we are successfully doing this therapeutic hypothermia technology in our babies, successfully discharge this kind of babies, in which the therapeutic hypothermia is nothing but we usually used to maintain the temperature of 33.5 for 72 hours after birth, and that should within 6 hours. And it really wonderful effects how we have observed in the babies. The babies neurologically are really doing well in the future, in their future life. We are using each and everything in ONP with, as per just now told regarding the invasive, non-invasive, high frequency ventilation technology, therapeutic hypothermia. With the premature the problem are like respiratory distress syndrome. So we are CPAP, bubble CPAP machine. We are using high frequency HFNO, that is called a high frequency nasal cannula, that are also using. Along with that, some babies will come with the jaundice problem also, which are commonly seen on day 3 till day 5 or sometime day 1 also. So we are using a very high, very effective LED phototherapy also in our unit. So each and every part, all the whatever the modalities are the latest modality we are using in our ONP hospital. In medicine, definitely the key is the surfactant, which are very common because right now many of the IVF pregnancy are there, and the IVF delivery are usually we are getting the premature delivery in that. So these premature babies are, we usually used to give a surfactant. It is nothing but it's a liquid like thing which is used as a medication also, which is normally present in each and every newborn, but at the age of 9 months of delivery. In these premature babies, these surfactants are not there. They usually start initiating from 28 weeks. But if the baby deliver before that, like we labeled this as a premature delivery with low birth weight, means low birth means less than 2.5 kg, very low birth weight, that is less than 1.5 kg, and extremely low birth weight, that is less than. So in these baby who develop respiratory distress syndrome, that is labeled as RDS, we usually use a surfactant, which is a very wonderful drug which we usually give within 1 hour to the baby as early as possible after delivery, and the baby are really doing very well in the life. So then the requirement of ventilation will come down, and we wean from ventilation as early as possible, and the baby will be doing well after that surfactant therapy. So this surfactant is really doing a wonderful thing in the premature babies preferably. As a social responsibility pediatrician, I will consider me as I am the pioneer. We can explain because we usually take school health camp also. Our responsibility as my key to explain regarding the diet therapy, regarding growth and development, and the most important thing is the vaccination. So my role as a socially to explain the parents regarding their diet, regarding their nutrition, regarding their growth charting, that is the growth and development plotting, and along with that immunization with a good health, with a good diet. For message to all the people as from side as a pediatrician is the most important thing for the mother who had delivered a baby is exclusive breastfeeding. That is, mother's milk is the best in the world. That is the gold one. So we need to give exclusive breastfeeding till 6 months. After that, we need to start weaning from 6 months slowly. Along with that, we need to give a supplement in the form of zinc, which can reduce the diarrheal problems and the respiratory issues also with the infants. Along with that, vaccination is very, very important. If you give a vaccination, they are like preventive one. So my key message is to give a good environment with a good vaccination and with a good treatment for all the children and all the neonates also especially. Thank you so much.